Hey everyone, I'm Dr. Krueger here at Rice Village Animal Hospital, and we're here with our clinic mascot Padre to talk about spaying and neutering your dogs.
Dr. Krueger, what is the difference between dog spaying and dog neutering?
Well, spaying a dog is for females, and so what that entails is actually removing their ovaries and uterus. And for neutering, that entails male dogs mainly, and that's removing their testicles.
How does dog spaying or neutering impact the health and well-being of my pet?
So spaying and neutering your pets is good, and I know you've heard Bob Barker probably say it. It helps control the pet population, and I know for your household pets, once you have them, that's probably not the biggest issue, but one big thing is we don't want them reproducing when it's unwanted, and that can severely affect especially females, especially if they're too young to go through a proper pregnancy or anything like that. And so I think the big things though are it helps prevent for females different types of cancers and uterine infections, and in males testicular cancer and prostate problems.
How soon should I bring my pet in to see a veterinarian to get my dog spayed or neutered?
Usually a lot of times we recommend between 6 and 8 months, but that will depend on the breed of your dog, how big they are, and everything. So it'd really be a better question to set an appointment up and see what's best for your pet, to ask your vet that.
What are some possible conditions that can be helped by spaying or neutering my dog?
Well, I think the big one is for spaying is keeping them from getting pregnant. I think we said that a little earlier, but big one is pyometra, which is a uterine infection, and these are for females, of course. And then the dogs won't get uterine cancer because they won't have a uterus anymore, or ovarian cancer, and it really does decrease their chances of getting mammary tumors later in life, and that's if we fix them really before their third heat cycle. And for males though, big things are behavioral. Some dogs are easier to train, or if they're starting to get aggressive, fixing them along with training can help that a lot. But also dogs that don't have testicles can get testicular cancer, and also it decreases the chances of male dogs getting any prostate problems later on in life.
How will spaying or neutering affect my dog in the future?
Well, I think it does. What we know for now is that it creates a better, well-rounded dog, but there are things that are changing dramatically with research and everything like that. But as of right now, the best thing you can do is to spay and neuter them to prevent some of these conditions that we talked about previously.
What will my veterinarian need to know about my dog before spaying or neutering?
Big things will be for females to get them spayed is have they gone through heat cycles before, of course, have they been around intact males, make sure they're not pregnant, and sometimes we'll hold off on spaying a dog if they're in active heat, but that's probably the big one for spays. And for neutering, it really comes down to their age, diet, and kind of what you're going to use them for. And if that's hunting, if that's a working dog, or if they're going to be a couch potato at home.
How long will it take for my dog to recover from being spayed or neutered?
So generally it's about 10 days, and that's to recover from the skin incision and for the body wall to heal for a spay. But for most neuters, a uncomplicated neuter, they're going to be 10 days, and you don't want to bathe or let the dog swim, and you really want to keep them exercise restricted as well.
What care should I be prepared to provide at home while my dog is recovering from their spay or neuter surgery?
So while you have your pet at home, regardless of spaying or neutering, you want to keep them calm for at least those 10 days. Keep them from licking their incision site, so usually we'll place a cone or a bodysuit on them. And those are really probably the big things. And I think looking at their incision site on a daily basis is a good thing to see if there's any infections starting. And if you're not going to be around them, please put a cone on them, because we don't want them to lick their incision open or pull their sutures out. If you have any questions about getting your dog spayed or neutered, give us a phone call, because we're here to always care for you and your pets. Thank you.